Self-Management Week. Co-designing a toolkit for epilepsy self-management. Zoë Prosser, Participatory Design Practitioner and Lecturer. Lorraine Jackson, William Quarrier Epilepsy Centre Manager. Follow us on X at selfmgmtscot, Health and Social Care Alliance Scotland.
Hi there, I'm Lorraine Jackson and I'm the hostel manager here at the William Quarrier Scottish Epilepsy Centre. We are an independent hospital run by the social care charity Quarriers and quite uniquely sit within that organisation. We are a national service for the whole of Scotland and we work in partnership with NHS, so all 14 health boards can refer their patients to our centre and we see patients that have complex epilepsy or a differential diagnosis. We moved from Quarriers Village about 12 years ago and the organisation has a long history in terms of supporting people with epilepsy. So, as I said, we see patients from all over Scotland. Patients come in for typically up to 3 weeks to get their epilepsy assessed and monitored within a safe environment. We have patients aged 16 plus. And we have a multidisciplinary team within the centre that is made up of psychology, psychiatry, neurology and self-management. And we introduced self-management to the service 3 years ago. Now, I can see our previous psychologist is on the call today. And he was instrumental in terms of moving towards a self-management model. As I said, many of our patients stay for up to 3 weeks with us. And that gives us time and space to explore in terms of people living with a long-term condition. And sometimes it's maybe not just the condition that needs treatment in the conventional way. It's obviously about self-management in terms of lifestyle, and that's where we introduced our lifestyle management programme, and that was initially funded from the Neurological Action Plan and then moving on to developing a supported self-management toolkit. In the room today, we've got Yvonne, who I'm very grateful to joining us today. We will see her in the video later, but it was hugely important that this toolkit that we're talking about today was co-designed and directly influenced by people with lived experience, and Yvonne has that. Yvonne was with us as a patient on 2 occasions, Yvonne. So I say I'm very grateful for her input today, and I'm sure that you'll take questions as well from anybody in the panel in terms of the process and working with the team and co-designing and what a toolkit that we're really pleased and really proud to share with you today.
Yeah, and thank you so much, Yvonne. Great, thank you very much, Lorraine. So yes, that's a lovely picture of the centre there, and behind the scenes, the beautiful other side of the centre. So yeah, I think just personally it's a wonderful place to be. I think you've got an amazing resource here, and yeah, just a very creative space for developing new approaches also. Okay, so I'll just start sharing some of the process and the co-design process for how we got to the toolkit. I guess at the beginning, we started with a bit of a brief from the Quarrier Centre. And I guess, well, I'm telling you what you wanted to do, but this was the brief that we started off with. And it was very much about building the self-management capacity of those with epilepsy and of those with epilepsy who'd been through a complex journey as well. And it was really about trying to deliver appropriate resources to help patients engage in self-management. And I think it was also in recognition that there's limited resources, and it, as you said, it takes space and time to really learn and try out different things and be in the centre. And not everyone can access that straight away. There's waiting lists, or you have an amazing 3 weeks in the centre and then you have to go home. And how do you take some of those learnings and community back with you? So it was very much around all of the services that are already delivered, but thinking about the resources to extend that and make it more accessible. And again, you won't really see the word toolkit because I think that evolved through the process. At this point, it was just about creating resources and access to self-management. And of course, there was the desire to take a really participatory co-design approach, which meant working with people who had epilepsy, but also families, practitioners, and really trying to get as much knowledge and voice into the design of those resources. So I guess Lizzie and I came along with our discovery, develop and deliver design process, which you might have seen before if you've done a co-design process before. But we split the project into 3 phases. So it was really about trying to discover what the challenges were that people were facing before we jumped to any solution. And then we worked with people to really develop the resources. And then at the end, we sort of evaluated them and delivered it as something that was quite accessible, which is that digital toolkit that hopefully you can access via the link in the chat. I don't know, Lorraine, if you wanted to add anything to that.
No, I think just as you said, Zoe, it was a development in terms of this idea, and then I think organically it just grew with lots of input information from all different areas of how valuable putting this all together would be for people.
Yeah, so we went into it, we didn't know what format it was going to take, we didn't know where it was going to live or what it was going to look like, and all of that evolved through the process, absolutely. So I guess we started off with what does self-management mean to us? And I guess this is probably quite a standard identification of self-management, but this was the starting point for the project. So we were using the definition from Gone Yourself, which came from the Alliance, and that's about self-management being a successful outcome of a person, but all appropriate individuals and services working together to deal with the very real life implications of living with a long-term condition. And I guess the phrase that we started using most prominently was living life to its fullest, or living as well as possible. So I guess our terminology adjusted throughout the project, but this was where the inception came from. Now, there were also indicators of self-management that I think were previously derived from work that Lorraine and others had done. And so we took those indicators and we also evolved them and further tested them. So what you're seeing on the right-hand side here is self-management defined through emotional well-being, self-management abilities, and about improving independence. So you'll see there various different qualities of self-management, such as meeting new people, feeling confident, knowing how to ask for help. These were the metrics that we used to evaluate the work as we were going, and we'll talk a little bit about how they evolved too. So I'll take you through the 3 phases. Our first phase was the discovery, and we were really discovering. And what I'm doing is just giving you a bit of a project overview. I won't linger too long on any of the slides because some of them are a bit dense, but if anybody wants us to go back to something later, we've got time to do that and dig into it. But you're just getting a sense of what the phase looked like. So we had a lot of check-ins to make sure that we were taking the right approach. We did interviews with practitioners, so that's our stakeholder interviews. So that was people in clinical and social work services who were supporting people with epilepsy. But also we did a lot of focus groups. So we did 2 focus groups, one with the current lifestyle management group, which was what Sam was running inside of the centre. And then we also did some interviews and focus groups with past patients, so people who had gone through the journey of working with the Epilepsy Centre and had gone on to various other places. That was really important because it was also people who were geographically distributed. So we spoke to people who were living in rural places, what was self-management like there versus in Glasgow or another city. And then we had a steering group, which was our incredible colleagues from Thistle as well, who supported us with that. So Thistle Self-Management. And I just wanted to share a little bit of some of the explorative questions, because these might be helpful in different contexts as well. But we really had 3 different kinds of questions that we were asking. I think, first of all, we wanted to know what people thought when they heard the term self-management. Does it actually make sense? Do they know what that means? Where did they come across that term? Can they offer some examples? And I think that was really interesting because, if I'm being completely honest, it was a term that a lot of people didn't know. They hadn't come across it. So it was important that if you're creating resources for self-management, it might not be helpful to actually call it that. So that was really helpful for us. And you'll see in the toolkit, it's a self-management toolkit, but all the language and the search functions are much more quality focused. So it's about speaking to employers or learning how to tell people about epilepsy. So we made it much more descriptive. We also wanted to understand what were the key moments in someone's life or even day when more support was needed. So what happens when you really need some support? What are you feeling in that particular moment, and what tools or resources are you reaching for? And then we sort of took a zoomed out approach, and we started thinking about overall journeys. So how has someone come through an epilepsy diagnosis, understanding that that can be a very long process, and there can be a lot of returning to diagnoses and looking at medication and changing that. So we were looking at these much larger journeys and trying to understand when support was needed and what the gaps were as well. So I'm just going to show you some of the methods that we used to do that, and we did that in person and online. I guess one thing to say as well is, I know we're using screens here, but using screens is not the best approach when you're bringing people together who do have epilepsy or are supporting people with epilepsy. So we did a mixture of both. We did remote activities and we did in person as well. And so we did one activity that was about understanding these kind of definitions of self-management and key moments. So we took all of these indicators and we kind of visualized them, and we tried to ask really specific questions. So when can your emotional well-being be improved to help you ... And it was to help you go out and engage in activities or meet new people or try new things. So these were really specific questions, but we were trying to get a sense of what actually helps undertake self-management activities at that granular level. What are some of the tools or organizations or services that would help? And it was really interesting because you just open up the conversation and people start talking about things like their pets, how important music is, the kinds of things that you wouldn't necessarily think of. But I think asking really open questions enabled us to get that much wider, diverse understanding of what self-management can be. And we did the same for increasing self-management abilities. So these are things like knowing what support's available, knowing how to access that support, feeling in control, knowing what support you need at what time. And then also independence. So things like being able to ask for help, feeling confident, setting life goals. Knowing what services I can use, I think, was a really interesting one, because a lot of the time people didn't know what services were available. And that's kind of one of the cornerstones of the toolkit, is that it's about creating access to services. So creating that visual overview. And then this is the in-person version. So this, I think, actually the idea of having a toolkit sort of emerged through these conversations, but it was something that someone said in an earlier interview, and they said, oh, it's a bit like having a toolkit and you've got all these things with you and you just have to know which one to pull out when. So we went with that metaphor and we made just a really simple cardboard box that was metaphorically a toolbox. And then we put all of the indicators inside of that toolbox and passed it around and asked people to pick one out and talk about that. And if they came up with something that supported them, it was something that we could put in that toolbox. So really quickly, we started to build up a picture of these indicators, what enabled them to be met and what didn't, what challenges were faced, which of these indicators were particularly challenging and why, and what kinds of tools would you put in this toolbox. So that was looking quite specifically at moments of self-management, but then again, we took that zoomed out approach and we looked at the bigger journey. So what's epilepsy like over the course of a lifetime? And I think it's important to think about, it's not just about stages in your life or stages in your diagnosis, but you could move house or have a child or, just everyday normal things that actually make quite a difference and make a lot of change. So yes, we were asking, how do you feel at different stages of your journey? What worked well and when? And what would help you to feel more supported at those moments? So again, we sort of created the journey at a high level, and that was also through interviews with people beforehand, before we took it into the focus group. So we started with kind of first signs of epilepsy, and a lot of people talked about having first signs of epilepsy long before going through any sort of official diagnosis process. So it was really important that we thought about the right starting point. It wasn't necessarily your first appointment or your first conversation about epilepsy. It was about maybe a lot longer before then. Then it was about how did people find out about what was happening to them. And then we looked at making adjustments and then looking at kind of long-term self-management. And I think we're sort of doing a bit of an injustice here because we've presented it in a way where it looks quite linear, but it's not. It's a lot of loops and returning to and reconfiguring and going backwards and then going forwards. So that was represented in the conversations as well. We also put the Quarrier Centre into all of this because it was referenced consistently by everyone that we spoke to that the experience they'd had throughout the centre had been quite key in changing that journey from making short-term adjustments to making much longer-term self-management adjustments as well. And again, you're seeing here the kind of physical version. So this was printed out really big. And then we looked at different people's examples of their journeys throughout this. And we were mapping, I think, in blue, I think it's the things that helped, the challenges that were faced, and green was the support or the things that did help. We also then took a step back and just sort of reflected on what could have helped. So maybe gaps that existed, but what would have helped you in that moment. And that really helped us come up with some ideas for things that didn't exist. And then we took, again, a bit of a step back from that, and we did some more interviews with practitioners and people who were already delivering lots of amazing support. And we thought about, well, what's in the landscape of self-management for people with epilepsy and just for people in general. And I think I just wanted to pause on this for a moment because I think it's really interesting that we sort of went into this project with the sense that designing an app or designing some sort of tracking support would be helpful. So to help people understand their seizures and understand their moods and feelings and track that. So we had a look around and we found out that there was actually 49 apps that we could find that already sort of promised to do that. And not a single one of them was mentioned by most of the people. There was a few that were mentioned by practitioners and I think a few previous patients that we'd spoken to, but in most of the focus groups, not a single tracking app had been used. So we wondered why, and I guess there was a number of different reasons. I think some of the apps were not sort of digitally accessible for everybody. Tracking for some people was quite manual. They were doing it with their own support workers. But we sort of came to the realization that creating another app probably wasn't going to solve the problems that we'd identified. But it was really important to get that assumption out and then investigate it and then return to the brief. So there was a bit of a reiteration of our brief at this point as well. We did have a lot of gaps identified also, which if anybody wants to dig into later, we can do. And just also to say positive things about all the amazing resources that were there. I think one of the most beneficial points of the whole journey was just bringing different people together to talk about the support that they were accessing, because so many people had an amazing resource that somebody else had never seen, or vice versa. And there was a lot of kind of knowledge exchange and sharing that happened throughout the co-design process. And I think that in itself was quite impactful. But what we did was we just categorized all the support that we could find. And again, maybe this is something that we should share more broadly as a visual, but it is in the toolkit as our resources. So you'll see that we've sort of categorized it into different types of support, from one-to-one expert support to community building to online resources. Some of them are quite formal. So I think everything that's underlined is a formal tool or something you can access. But there's lots of other things that are informal, like just exercise, engaging with pets, music, singing, dancing. And it's not to say that one is more important than the other, but I think these were the ones that were sort of most commonly discussed. So I think at this point we started to realize that there's a lot out there already, a lot of amazing work in self-management, but the access points to find it was the challenge, or to share it.
Watch part 2 for more on the toolkit, findings, and for testimonials. Alliance Live.